Dear pharmacist grade 2 aspirants, welcome to Whiteboard Learning app. I am Dr. Suchitra and in this session I am going to discuss the Grand Test 4 paper, question paper. So coming to the question paper, first question, here they have given assertion and reason. Welcome to Whiteboard. So coming to the assertion, emulsions are in this session I am going to discuss the Grand Test 4 paper, question paper. Stable so system. Coming to the question paper, okay, coming to the reason, the presence of emulsifiers. Here they have given assertion and reason. Welcome to Whiteboard. So coming to the assertion, emulsions. So first of all, what are emulsions? Emulsions are the mixture of two immiscible liquids. Like these are of two types, oil in water and water in oil. Means one solvent, it will be dispersed in the other continuous medium. Okay, as a fine droplets in the other continuous medium. So emulsions are thermodynamically stable systems. No, it's not correct because they are thermodynamically unstable because it is a mixture of two immiscible liquids. So upon keeping for a longer time, then what happens? The two liquids get separated in order to reduce the interfacial tension. So the first assertion is the wrong one. What happened? Oksaరి chudandi. Right. Coming to the reason, the presence of emulsifiers reduces the interfacial tension between the two immiscible liquids. Yes, it's true. Emulsifiers are nothing but our emulsifying agents. So, it is a third substance we will be adding to that of the immiscible solvents or this emulsions in order to reduce the interfacial tension between the two immiscible liquids. So, here the first assertion is false and the reason is the correct. So, first statement is A is false and B is true. So, option D is the correct answer. So, coming to the next question. So, what is a continuous phase in water in oil emulsions? Already have told you emulsions are of two types. So, one is oil in water type and water in oil type, and we will be having oil in water in oil type also. Right. So, oil in water type. So, in this one solvent acts as a dispersed phase and other solvent acts as a continuous phase. So, here oil acts as a dispersed phase and water acts as a continuous phase or dispersion medium. Continuous phase. Okay. So, what is the question here? What is a continuous phase in water in oil type? So, in case of water in oil type, water acts as a dispersed phase, whereas oil acts as a continuous phase. So, in this the oil gets, the water will be dispersed in the form of a fine droplets in the continuous oil phase. So, what is the answer? Oil. So, oil is the continuous phase in the water in oil type of emulsions. So, coming to the third question. So, emulsifying agents stabilize emulsions by reducing the surface tension between the two phases. Yes, here what they have told, just now we have discussed, emulsifying agents are those agents, they stabilize the emulsion by reducing the surface tension or interfacial tension between the two liquids. Yes, that is assertion is true. Emulsions can only be formed with oil in water type. No, it can be oil in water type, water in oil type or oil in water in oil type also. So, the first statement is true and the second statement is false. So, option 3 is the correct answer. Coming to the next question, that is question 4. Right. Assertion. So, here they have given assertion. Adulteration is the herbal drugs can lead to serious health risks. So, adulteration leads to serious health problems. Yes, that's true. Okay. Next, reason. Adulterants are often toxic and they can interact with the active ingredients. That is also correct. See, what is this adulteration? So, adulteration is nothing but mixing a substance into another substance in order to decrease the quality of that particular product. Okay. So, while decreasing, for example, if you take honey, so they are going to mix the corn syrup or starch syrup in order to decrease the quality of that one, in order to reduce the cost for that one. Okay. So, that may cause some serious health effects also. So, here both assertion and reason is true and this is the correct explanation for the assertion. Okay, right. So here both A and R are true and it is the correct explanation of A. So coming to the next question. So which of the following is a common adulterant found in powdered ginger? So powdered ginger, already this powdered ginger is also available in the market. So that is adulterated with here capsaicin. So sand, no, they cannot adulterate with sand. Okay, chalk powder is white in color and it won't have any taste also. Whereas capsaicin, so capsaicin which is obtained from this capsicum, so that will be having similar spiciness. So because of the similar spiciness as that of the ginger, they will be mixing or they will be adulterating with that of this capsaicin. So option C is the correct answer for this one. Coming to the next question. So here deferoxamine. So deferoxamine is used in the treatment of toxicity caused by one of the following ions. Right. So this is not exact under this question. So up to this only the question will be. So here deferoxamine. So D means removal. Ferroxin. Fer means ferro, nothing but ferrous, that is nothing but iron. So the name itself tells that it is used for iron poisoning. Okay, so answer is iron poisoning. Whereas arsenic, lead and gold, mercury, they can be the antidotes for this type of poisoning will be dimercaprol. Dimercaprol is used for this type of poisonings. Whereas for treating cyanide poisoning, generally we will go for this sodium thiosulfate and sodium nitrate. Sodium thiosulfate and sodium nitrite, not nitrate, sodium nitrite. So these two are used as an antidotes for treating this cyanide poisoning. Okay, so option C, deferoxamine is used as an antidote for iron poisoning. So coming to the next question. Right, so the agent which is used to prevent dental caries. So first of all, what is this dental caries? So dental caries is it is nothing but formation of cavities in the teeth. Okay, so that is due to the acids produced by microorganisms which on the food remnants which are present in the crevices of the teeth. So whatever the food remnants that are present in the crevices of the teeth, in order to feed that one, the microorganisms will be acting on that one and they will be releasing the acids, and because of that acids, decalcification will be taking place and finally it leads to the formation of a cavities. Okay, so this generally these cavities can be overcome. This is also known as cavities. So these cavities can be overcome, but if we have an adequate amount of fluoride. Fluoride is mainly responsible for overcoming this problem. So fluoride will be generally it is present in our body in an adequate quantity, and even from municipal water which they are mixing, like fluoridation process will be done. So in that also they will be mixing that in drinking water they will be mixing this fluoride. So that is more than enough to prevent this dental caries. But if anything happens, like if cavities appears in any person, then they have to go for the compounds which contains rich in fluoride. So here sodium fluoride is the correct answer for this one, which contains fluoride. And next one is strontium chloride, zinc chloride. So if strontium fluoride is also effective for treating the dental caries, but not strontium chloride. So here the first option is the correct answer. Coming to the next question, amlodipine. So amlodipine is a dash derivative. Yes, so this is the structure of amlodipine. Okay, so here it consists of a pyridine structure. Okay, it consists of a pyridine structure. So in here at first position and third position we are having an hydrogen. So it is 1,4 dihydro derivative. So answer is 1 dihydropyridine. So amlodipine is a derivative of dihydropyridine. First option is the correct answer for this one. Coming to the next question, quinine can be detected by, okay, quinine can be detected by thylaquine test. Okay, quinine as well as colchicine. quinine and colchicine can be detected by this thalloquine test. And Legal's test. Legal's test is used for detecting cardiac glycosides. It is used for detecting cardiac glycosides. And meconic acid test. This meconic acid test is used for identification of this opium, morphine, alkaloids. Okay, and Vitali-Morin test. Vitali-Morin test is used for identification of tropane alkaloids. It is used for identification of tropane alkaloids. So, what is the correct answer for this one? Thalloquine test. It is used for detection of this quinine and colchicine. Coming to the next question. So, dosage regimen for tuberculosis leprosy. So, the person who is affected with leprosy and tuberculosis. So, what is the dosage regimen? In general, this WHO, World Health Organization, has recommended a dosage of this one. So, dapsone 100 mg daily plus rifampicin 600 mg once a month. So, that should be continued for 6 months. But single dapsone monotherapy is not recommended by WHO. Only a combination of rifampicin and dapsone is used. That's to dapsone at 100 mg and rifampicin 600 mg once a month for 6 months. Continuously for 6 months is the correct answer for this one. So, coming to the next question. 11th question is active metabolites of spironolactone. So, what is spironolactone? Spironolactone is a potassium sparing diuretic. Okay, so which removes the excess water that is formed in the body due to edema. So, that will be removed by this spironolactone. It is a potassium sparing, means it spares the potassium levels in our body. It will not allow the potassium to go out of the body. So, here the active metabolite of spironolactone. So, generally the active metabolite of spironolactone is canrenone. Canrenone, and one more is also there, that is canrenoate. So, this is a ketone form and this is the ester form of this one. And this canrenone is an active metabolite. So, in some countries like Europe, this canrenone is used as a potassium sparing metabolite. So, potassium sparing diuretic. Okay, so correct answer is canrenone and the other one is canrenoate. Coming to the next question. So, here soda ash. Soda ash is also known as. So, what is the synonym for this? Soda ash. Soda ash is also known as, so soda, in this only it is there, nothing but sodium carbonate. So, sodium carbonate is the correct answer for this one, and calcium carbonate is nothing but our limestone. Limestone or calcium carbonate, both are same, and pure silica, it will be having this, there is no synonym for this one. So, soda ash is also known as sodium carbonate. So, coming to the next question. So, which combination of the drugs is commonly referred to as Cotrimoxazole? Yes. So, in the name itself you can easily identify this one. What is meant by co? Nothing but combination of two drugs. Okay, so here trimethoprim. Okay, moxazole, nothing but methoxazole. So, sulfamethoxazole. So, it is a combination of sulfamethoxazole and trimethoprim. So, correct option is this one. So, cotrimoxazole is used for treating various bacterial infections. So, coming to the next question. What is the primary adverse effect associated with sulfonamides? So, whenever you see the sulfonamides, so they will be having always hypersensitivity reactions. Hypersensitivity reactions. So, here what they have given? Sensitivity reactions. So, nothing but it causes some skin infections like allergy or blisters, okay, rashes. So, this all comes under this one. So, here the four options are nephrotoxicity. Nephrotoxicity is nothing but toxicity of the kidneys. Okay, hepatotoxicity, toxicity of the our liver. And next, hemolytic anemia. It's a condition of anemia. Anemia due to hemolysis. Next, Stevens-Johnson syndrome. So, Stevens-Johnson syndrome is a rare skin disorder which causes rashes and blisters on the skin. So, the sulfonamides, it is associated with Stevens-Johnson syndrome. Whereas nephrotoxicity is caused by some antibiotics like aminoglycosides, quinolones, okay, rifampicin. So, these are the some drugs which causes this nephrotoxicity. And whereas hepatotoxicity and hemolytic anemia will be caused by these NSAIDs, non-steroidal anti-inflammatory drugs. So, the correct option is Stevens-Johnson syndrome. So, blindly you remember that sulfonamides will cause hypersensitivity reactions. So, coming to the next question. So, which sulfonamide is used topically to treat burns and prevent bacterial infections? So, here the first option they have given is sulfadiazine. So, all these 4 options belongs to this sulfonamides only, that is sulfadiazine, sulfacetamide, silver sulfadiazine and sulfamethoxazole. Okay. So, here sulfadiazine it is taken orally in order to treat bacterial infections, like sulfacetamide. Sulfacetamide, it can be used either topically or it can be go for the oral also. Both are available. And silver sulfadiazine. So, this is the correct option. So, here what this silver will do, it is having a combination of a metal. So, this metal they act by protein precipitation, that is it has a astringent effect. So, because of that astringent effect, it will cause the protein precipitation of the bacteria. And whereas sulfadiazine, they inhibit the synthesis of folic acid of that bacteria. So, overall it prevents the spread of that, prevents the bacterial infections. So, here silver sulfadiazine, which consists of a metal. Okay. So, that is used topically in order to treat burns. Coming to the next question. So, here they have given matching. Match the following. So, first option is epidermic ointments. So, here they have given ointments and what is the local effect, what is the action they exert. Okay. So, generally the skin will be having 3 layers. So, that is epidermis, dermis and hypodermis. Okay. These are the 3 layers. So, here epidermic ointment. So, epidermis is the outermost layer of the skin. So, here epidermic ointment. So, it is meant for producing local effect because they will be acting on the local, particularly it is localized to an area. Therefore, it will be having a local effect. And next one is endodermic ointments. So, endodermic ointments is meant for action on deeper layers of cutaneous tissue. So, endodermic. So, within the below the epidermis. So, it will be meant for action on deeper layers of this cutaneous tissue. Whereas diadermic means they will be having a deeper action, but they can enter into systemic circulation also. They will be having some systemic effects also. So, diadermic ointments are meant for deeper penetration and release the medicament into systemic circulation also. So, the correct option is for 1C. So, this is the B is the correct option. So, coming to the next question. A person develops the symptoms of food poisoning after eating at restaurant. Okay. The symptoms include nausea, vomiting and diarrhea. What is the most likely cause of these symptoms? So, it is a general symptom. So, generally ingestion of the food contaminated with bacteria, viruses or toxins. So, these toxins are mainly responsible for elimination of that water from our body. They prevent absorption of the electrolytes from the intestine. Therefore, it causes this diarrhea and vomiting and nausea. So, option C is the correct answer for this one. So, coming to the next question, question 18. So, white soft paraffin. So, here white soft paraffin is never used in the preparation of ophthalmic ointments. Yes, that's true. there will be two types of paraffins, yellow paraffin and white paraffin. So, yellow paraffin is the natural one and that will be bleached to get this white paraffin by adding some bleaching agent. So, what happens? It is never used in the preparation of ophthalmic. So, why we are not using? Because even the bleaching agents will be, a small amount of bleaching agents will be present in that white paraffin which may cause eye irritation. So, because of that we will be not using this in ophthalmic preparation. So, here the reason is white soft paraffin may contain small traces of, yes, that is true, it consists of a small traces of bleaching agent which are generally left over after bleaching the yellow soft paraffin. So, here assertion is correct, reason is correct and this is the correct, R is the correct explanation of A. So, the correct answer is, yes, both A and R are true and R is the correct explanation for assertion. So, first option is the correct one. Coming to the next question. Hydrous wool fat. Hydrous wool fat is a mixture of 70% of wool fat and 30% of purified water. So, this is a direct question. So, which consists of, see, the name itself tells that it is having hydrous, nothing but 70% of water and 30% of the 70% of the wool fat and 30% of the water. Yes, this hydrous wool fat is also known as lanolin, which is used as a ointment base. It is used as a ointment basis. Right. Next, wool alcohol. So, it consists of, alcohol contains not less than 30% of cholesterol. So, this is also correct one. So, lanolin, the wool alcohol is known as acetylated lanolin. It is known as acetylated lanolin. So, the correct answer is both the statements are true. Okay. So, this is a waxy layer. This is a wax which is obtained from the skin of this wool of this sheep. Coming to the next question. Which vitamin would you recommend to someone who is experiencing nose bleeding, okay, and easy bruising, given that these symptoms could indicate a deficiency in the clotting factors? Yes. So, here they have given 4 options, that is vitamin A, B12, K and D. So, what is the use of vitamin A? It is mainly used for eyesight, right? So, deficiency will cause some xerophthalmia or night blindness. Okay. Next, vitamin B12. So, vitamin B12 deficiency leads to pernicious anemia. And vitamin K. So, here vitamin K, it is mainly responsible for synthesis of clotting factors in the liver. Okay. So, if there is deficiencies, nose bleeding, clotting factors, it is mainly responsible for synthesis of clotting factors in the liver. So, if there is a deficiency of vitamin K, then what happens? There is a chances of nose bleeding. So, in that conditions, we will be recommending vitamin K so that the clotting factors will be produced in the liver and therefore, the nosebleed will stop. So, option C is the correct answers. And vitamin D, what is vitamin D? That is calciferol, which is used for formation of strong teeth and bones. Coming to the next question. Vitamin D is synthesized, okay, just now we have seen, right? It is synthesized in the skin upon exposure to UVB rays, ultraviolet B rays. So, generally 2 types of rays will be there, ultraviolet A and ultraviolet B rays from sunlight, and it is also essential for calcium absorption in the intestine. Yes, both are true. See here, vitamin D generally it is synthesized upon exposure to UVB rays. So, ergosterol and 7-dehydrocholesterol, whatever it is present in the skin, that will be converted into vitamin D3 upon exposure to UVB rays, ultraviolet B rays. Okay, and that vitamin D3, it acts as a hormone which is mainly used for helps in absorption of the calcium from the intestine. Therefore, both the statements are true. So, here option A is the correct answer. Coming to the next question, which vitamin is primarily involved in blood clotting? Okay, just now we have discussed vitamin K. Vitamin K is responsible for blood clotting. It is for the production of blood clotting factors. So, vitamin K is the correct answer, which is used for production or synthesis of blood clotting factors in the liver. And vitamin A, we know that it is used for this eyesight. Next, vitamin C for collagen production as well as wound healing and for boosting the immunity. And vitamin D for formation of strong bones and teeth. Next question. Assertion: parenteral administration can be used when the patient is unable to take the medication orally. Okay, right. See, whenever the patient is on bed and if he is not able to swallow the tablet, especially geriatric patients who are in ICU condition, at that time what they'll do, they'll be not able to swallow the oral tablet. So, at that time they'll be going for this parenteral administration, nothing but parenteral. Enteral is nothing but oral route, okay, through oral route, whereas parenteral nothing but apart from internal, which bypasses the first pass metabolism. Okay, right. Assertion is correct. And reason: parenteral routes bypass the digestive system, allowing for direct absorption into the bloodstream or tissues. Okay. See, directly we will be introducing into, it means if we give IV, it will directly enter into the blood circulation, so that they will be having a fast effect also, rapid effect also, right. So, they bypasses the digestive system because we are not taking through oral route. So, directly they will be entering into systemic circulation. So, both the assertion and reasons are true. Okay. And reason is the correct explanation for assertion. So, option A is the correct answer for question 23. Coming to the next question, 24. So, a patient needs a medication that requires a rapid onset of action, okay, and precise control over the dosage. Which parenteral route would be the most appropriate? So, here generally this parenteral routes are available in 4 types. One is intramuscular, intravenous, intradermal and subcutaneous. Okay, so these are the 4 types. So, out of which, so intramuscular means they will be, the injection will be given into the muscle. Okay, subcutaneous, so it will be introduced into the subcutaneous tissue, cutaneous tissue. And next, intravenous, which will be injected directly into the veins, that is bloodstream. Next, intradermal, nothing but below this dermis, in the epidermis layer. So, intradermal. So, these are the various things. So, here for getting rapid onset of action, directly we have to introduce into the blood circulation, so that they will be having a rapid action. So, here intravenous is the correct answer. So, coming to the next question. Parenteral administration refers to any drug, okay, any method of drug delivery that bypasses the gastrointestinal tract. Just now we have discussed, it bypasses the gastrointestinal tract, right, and it includes intravenous, intramuscular and subcutaneous routes. Yes, both statement 1 and statement 2 are correct. So, both the statements are true. Coming to the next question. Short acting skeletal muscle relaxant. So, here they have given 4 options, all these are muscle relaxants only, skeletal muscle relaxant. So, out of this, mivacurium, it is a short acting muscle relaxant whose action will last within 10 minutes. It lasts in 10 minutes. Okay. So, example is this one, mivacurium. So, next question, a silver nitrate reagent is used for limitasin IP4. Okay. So, silver nitrate reagent. So, here they have given 4 options. So, lead. So, in case of lead, the reagent used is hydrogen sulfide. Hydrogen sulfide, it reacts with that of the lead and gives lead sulfide and leads to the formation of a lead sulfide which will give a brown color to the solution. Whereas chlorides, so here these chlorides, if any chloride impurities are present in the sample, then that will react with that of the silver nitrate and gives silver chloride precipitate. Okay, it gives a silver chloride precipitate. So therefore, the correct answer, what they have given, silver nitrate reagent is used for limit tests of chlorides. So in case of iron, so this iron impurities are reacted with thioglycolic acid so that it forms ferrous thioglycolate. It forms ferrous thioglycolate. So this ferrous thioglycolate will give pale pink to purple reddish color. Thioglycolic acid. Okay, right. So this is not correct answer. Next is sulfate, and these sulfates can be determined, sulfate impurities can be determined by adding barium sulfate reagent. Nothing but that barium sulfate reagent contains a small amount of barium chloride which will react with the sulfate impurities and forms a barium sulfate precipitate. Okay, so the correct answer is chlorides. Coming to the next question. Captopril is an, okay, captopril is a AC inhibitor, MAO inhibitor, HMG-CoA reductase inhibitor and alpha glucosidase inhibitor. So it is a ACE inhibitor, nothing but angiotensin converting enzyme inhibitor. Okay, so generally this angiotensin 1 will be converted into angiotensin 2. So which is a potent vasoconstrictor in the presence of an enzyme, angiotensin converting enzyme. Okay, so what it will do, this ACE inhibitors, they will inhibit this angiotensin converting enzyme so that the angiotensin 1 will not be converted into angiotensin 2, so that the constriction will not be taking place and it causes the dilation of the blood vessels and reduces the BP. So it is used for treating the hypertension. So first one is angiotensin converting enzyme. Coming to the next question. PPIs, that is proton pump inhibitors. Proton pump inhibitors. They inhibit. So here they have given various enzymes like calcium potassium ATPase enzyme, potassium sodium ATPase enzyme and hydrogen proton potassium ATPase and sodium potassium ATPase. So the name itself contains proton pump inhibitors. So it is related to this one, proton potassium ATPase inhibitors. Okay, right. So here our stomach cells, stomach will be having a specialized cells called parietal cells. So generally it will have a parietal cells, and these parietal cells will be having a protein, it will be having this proton potassium ATPase pump. Okay, this will be having this proton potassium ATPase pump, and which is responsible for the production of HCl in the stomach. Right. So what this proton pump inhibitors will do? They inhibit this potassium, this H plus proton potassium ATPase enzyme, so that the HCl will not be produced in the stomach, and therefore it can prevent the formation of ulcers. Duodenal, it prevents the formation of ulcers. Okay, right. So proton pump inhibitors act by inhibiting this enzyme, that is proton potassium ATPase enzyme. Coming to the next question. Alkanoptoria is a metabolite. Disorder of dash amino acid. Okay, so alkanoptoria is also known as black urine disorder. It is also known as black urine disorder. Okay, so generally amino acids like phenylalanine and tyrosine, they undergoes metabolism to means they'll be completely, they have to undergo metabolism, hasn't it? So what happens, it is a genetic disorder. So, in some genetic disorder condition, what happens? The enzyme will not be available for converting this phenylalanine and tyrosine into metabolite. Okay. So, generally during this metabolism, it will give a homogenetic acid. It will give a homogenetic acid which is responsible for the production of black color to the urine. Okay. So, they will not be completely metabolized. Definitely they have to undergo metabolism, but they will not be completely metabolized due to lack of an enzyme. So, therefore, it will produce a homogenetic acid, and this is responsible for production of this black color urine to the black color to this urine. So, that is why alkanopturia, it is also known as black urine disorder. So, first one is phenylalanine and tyrosine is the correct answer for this one. Coming to the next question, ethynyl estradiol. Ethynyl estradiol is used for, so what is the use of that one? Abortions, birth control pill, male sex hormones and children growth. So, birth control pill like a combined oral contraceptives. So, generally these oral contraceptives will be containing a combination of progesterone and estrogen. So, this ethynyl estradiol, it is mainly used as a birth control pill. Pancreas, so that insulin will be produced. Okay, right. Whereas metformin, they inhibit hepatic gluconeogenesis. They inhibit hepatic gluconeogenesis. Okay, so due to the inhibition of this hepatic gluconeogenesis, it will be exhibiting its activity. So, therefore, metformin is the correct answer. Coming to the next question, hepatitis B. Hepatitis B is a transmitted through contact with infected body fluids, and it can be lead to chronic liver diseases. Right. Hepatitis B is caused by hepatitis virus. So, there will be two types of virus, hepatitis A virus and hepatitis B virus. And this hepatitis B is caused by hepatitis virus B, and it is transmitted through contact with the infected body fluids. Yes, that is correct. The first option is correct, and it can lead to chronic liver disorder. Hepatic is nothing but liver. Hepatitis, so inflammation of the liver. So, it leads to chronic liver disease. So, both statements are true. Coming to the next question. Right, next question is, what is the primary symptoms of cholera? Okay. So, cholera is affected by some what is the primary symptoms of this cholera? Right. See, cholera is a bacterial infection. So, this cholera causes infections of this intestine. So, it mainly causes the infections of this intestine, so that it leads to severe diarrhea, that is rice water stools. It is also known as rice water stool. It also causes vomitings and severe diarrhea. Okay. So, the correct answer is severe diarrhea. Whereas jaundice is caused by this hepatitis B virus. Just now we have seen. So, that is caused by hepatitis B virus. So, correct answer is this severe diarrhea. It is also known as rice water stools. So, next question is, coming to assertion, the Medical Termination of Pregnancy Act, MTP Act 1971 was enacted to provide a legal framework for abortion in India. Yes, that's true. In the first grand test also I have discussed about this MTP Act 1971. So, which was enacted to provide legal framework for abortion in India. That's true. And reason, the Act ensures that abortions are performed under safe conditions by qualified medical practitioners. So, this is also correct one. So, the Act, what they have given, so it can be performed, but under supervision of this qualified medical practitioners. Yes, both the statements are true, and this one is the reason is the correct explanation for assertion. Coming to the next question. A woman seeks to terminate her pregnancy due to severe fetal abnormality. If there is a severe fetal abnormality which was detected in 22 weeks, that is around 5 months of the pregnancy. So, according to the Medical Termination Act of Pregnancy Act 1971 and its amendments, what steps should be taken to proceed legally? Yes, already they have diagnosed that the fetus is having a severe abnormality. So, under those conditions, they can go for this. See here, she can terminate the pregnancy with the opinion of one registered medical practitioner. No, she has to seek the 2 medical practitioners' advice. She needs to obtain permission from the judicial body. The pregnancy can be terminated if 2 medical practitioners confirm the risk. Yes, they have to take the opinion of 2 medical practitioners. So, upon confirmation of the risk only, then only they can go for this abortion. So, correct option is C. Coming to the next question, a pharmacy professional should be, so how he should be? Incapable of lateral thinking? No. Next, not approachable? No, this is also incorrect. Unavailable? No, he should be available anytime. Next, observant. Yes, he should be an observant. And he should be always available as a front warrior in order to protect the people. So, coming to the next question. What is the role of an enzyme in the chemical reaction? So, what is the role of enzyme in chemical reaction? So, here first option is to provide energy for the reaction. No. To decrease the activation energy of the reaction. To act as a substrate in the reaction. No. To increase the activation energy of the reaction. So, these 2 are wrong. And with respect to activation energy, so here they have given activation energy. So, generally this rate of reaction, any rate of reaction or rate of chemical reaction, it is inversely proportional to activation energy. It is inversely proportional to activation energy. Means if you reduce this activation energy so that we can increase the rate of reaction. So, here that can be done by our enzyme. So, in order to proceed the reaction very fast, so what it has to do? It has to reduce the activation energy. So, to decrease the activation energy of the reaction. So, this is the correct answer. So, coming to the next question. Match the following enzymes with their respective coenzymes. Okay, so here they have given 4 options, that is pyruvate dehydrogenase enzyme, lactate dehydrogenase enzyme, glutathione reductase and acetyl-CoA carboxylase. Okay, so here pyruvate dehydrogenase. So, its coenzyme is this coenzyme A. Even NAD plus also act as a coenzyme for this one, and thiamine pyruvate pyrophosphate also acts as a coenzyme for this pyruvate dehydrogenase. So, what is coenzyme A will do? This will help in transfer acetylation, this transferring the acetyl group. Okay, so pyruvate dehydrogenase enzyme, its coenzyme is coenzyme A. Next one, lactate dehydrogenase enzyme. So, for lactate dehydrogenase enzyme, this NAD, nicotinamide adenine dinucleotide, acts as a coenzyme for this lactate dehydrogenase enzyme. And glutathione reductase. So, glutathione reductase, its coenzyme is NADPH, and acetyl-CoA carboxylase, its enzyme's coenzyme is biotin. So, the correct option for 1 to D. So, B is the correct option for this one. So, these are all you can directly read from this biochemistry, U Satyanarayana. Okay. If you go through all the cycles like citric acid cycle, glycolysis, gluconeogenesis, definitely you will come across all these enzymes as well as their coenzymes. Next, coming to the 40th question. So, a patient presents with symptoms pellagra. Yes, a condition caused by deficiency in niacin. So, what is niacin here? It is a vitamin B3. Niacin is a vitamin B3. So, which coenzyme derived from niacin is likely deficient in this patient? Okay, right. So, niacin generally it causes, so deficiency of niacin causes pellagra. Okay, this is very important. See, pellagra, it includes 4 Ds. Okay, so nothing but diarrhea, dermatitis, dementia, and finally it leads to death of a person. Okay, so deficiency of niacin causes 4 Ds, that is diarrhea, dermatitis, dementia, and as well as this it leads to death of a person. That you remember. So what is happening here? So niacin immediately after absorption, it gets it undergoes metabolism and forms an active metabolite, that is NAD+. Okay, that is a coenzyme. So if there is a deficiency of niacin, then what happens? There will be a deficiency of this NAD+ coenzyme. So correct answer is B. Coming to the next question, what is the role of antibiotics in disease prevention? So antibiotics generally they will be acting on the, they target the bacteria, bacterial cell wall, means they target the bacteria, therefore it is used for treating the bacterial infections. So here they have given 4 options. They are used to treat viral infections, they are prevent bacterial infections, they enhance the immune system, and they are used in vaccine. So correct answer is bacterial infection. So antibiotics mainly target the bacteria, therefore it is used for treating the bacterial infection. So correct answer is B. Coming to the next question. Right, here match the following diseases with the preventive measures. So here they have given 4 options, that is malaria, tuberculosis, HIV and influenza. So coming to the malaria, so we know that malaria is caused by Plasmodium falciparum or Plasmodium ovale or Plasmodium malariae. So 4 species are there. So due to that it may cause, and this will be transmitted by a female Anopheles mosquito, right? So that can be prevented by using mosquito nets. Okay, right. Tuberculosis. So tuberculosis generally for tuberculosis we will be going for this BCG vaccine. So immediately a birth of a child, within 28 days of the birth of a child, they will be giving the BCG vaccine on the left hand. Okay, so this BCG vaccine is nothing but Bacillus calmette-guerin. So which is named after the discovery of the scientist Guerin. Okay, so this vaccine will helpful in preventing the tuberculosis. Right. Next, HIV or AIDS. So human immunovirus or acquired immunodeficiency syndrome. So this is a sexually transmitted disease. So safe sexual practices ought to be followed as a preventive measure. Next, influenza. So influenza is also treated by vaccination. Nowadays the government is giving this influenza vaccine also, that also came into existence. So coming to the correct option, 1A. Right. So option B is the correct answer for this one. Coming to next question. A community is experiencing a rapid spread of unknown respiratory disease. Okay. So it is related to respiratory conditions. Okay. Respiratory tract infection. So the immediate preventive measure should public has to recommend to limit the spread. Okay. So it is related to our respiratory tract system. So what we have to do? We should recommend the use of mask and hand hygiene. Okay. So whenever they will sneeze or whenever they snatch, at that time definitely they have to maintain the hands hygiene and mask in order to prevent the spreading of that disease. Coming to the next question. Assertion here, immediate and thorough washing of wound caused by an animal bite can help prevent rabies. Yes, so rabies is a disease. It is also known as hydrophobia. Hydrophobia, nothing but phobic, which hates, which they will be having a fear of taking liquids. Okay, so that is called hydrophobia. So rabies infection. So reasons: washing the wound with soap and water can reduce the number of viral particles at that bite. Yes, that's true. So, generally this rabies will be affecting this dogs. So, the dog saliva will be containing this rabies virus. Okay. So, if they are properly vaccinated, then there won't have any problem. But if that dog saliva, if the dog bites us, then what happens? That virus will be entering into our body, and it causes hydrophobia, and it's very dangerous. Finally, it leads to the death of that person. So, washing the wound immediately, what it will do? It will prevent the spreading of that viral particles. So, here both the statements, so both assertion and reason are true, and reason is the correct explanation for assertion. So, rabies virus is very dangerous. Coming to the next question, match the following disease with the corresponding preventive measures. Okay, so here they have given 4 options. Just now we have discussed about rabies. So, rabies virus, it is spreading because of this pets. Okay, so we have to go for vaccination of the pets. And next one is botulism. Botulism. So, botulism is it is a food poisoning. So, it is a food poisoning which is caused by Clostridium botulinum. It is caused by Clostridium botulinum bacteria. Okay. So, why this is happening? So, this can be overcome by avoiding canned food with damaged package. Okay. So, canned food means by processing of the by canning process, they will be preparing and they will be applying heat and they will be sterilizing that food. If it gets damaged, then there is a chance of entering of this Clostridium botulinum into that one, and which leads to poisoning. So, botulism, avoid canned food with damaged packaging. Next one is E. coli infection, that is Escherichia coli infection. So, this can be overcome by properly cooking the food. Okay. Next, Campylobacteriosis. So, Campylobacteriosis, this bacteria, it is mainly responsible for this, and this can be avoided by consumption of unpasteurized milk. That is, we need to properly pasteurize, or unpasteurized is nothing but a raw milk. We should not take any raw milk that may contain this Campylobacteria, and it may cause some infections. So, the correct answer is, so 1B, 2D, okay, option A is the correct answer for this one. Coming to the next question, the heteroatoms present in phenothiazine are, okay, so phenothiazine is a heterocyclic compound. It is a heterocyclic compound which consists of a thia group and then aza group. Okay. So, this is thia. Thia is nothing but sulfur, which contains 2 heteroatoms, sulfur and this nitrogen. And nitrogen is nothing but aza, and sulfur is thia. Okay. So, what is the options here? Oxygen and nitrogen. No, it's wrong. Sulfur and nitrogen. Yes, that's correct. So, oxygen, if it is oxygen is present, then they will be telling it is a oxa. Right. Nitrogen, if 2 nitrogens are present, then it is said to be diaza. So, the correct option is sulfur and nitrogen. Coming to the next question. In the presence of food, absorption of drugs such as ampicillin. So, absorption of ampicillin drugs either increases or decreases. That is the question. So, here in the presence of, generally food reduces the absorption of this ampicillin. It reduces the absorption of ampicillin. Therefore, it is recommended to take ampicillin in an empty stomach only. Okay. So, option D is the correct answer. It reduces the absorption of this ampicillin drug. Coming to the next question. The price fixed by the Indian government. Okay. Scheduled formulations according to the provisions of Drug Prices Control Order is called. Okay. So, the first is the ceiling price. So, in order to prevent the burden on customers, see, especially on foods, gas and medicines. So, government will impose this this tax, or they will be fixing the price in order to prevent the burden on the customers. Okay, so that is called ceiling price. So next one is, coming to the next question. Match the following conditions with their corresponding characteristics. So here they have given type 1 diabetes, type 2 diabetes, duodenal ulcer and gastric ulcer. So type 1 diabetes. So type 1 diabetes is caused by autoimmune destruction of beta cells. So generally beta cells of pancreas, that is islets of Langerhans, are responsible for production of this insulin. See, if they get insulin is mainly responsible for regulation of the glucose levels in the blood. Okay, so what is happening here? If there is a destruction of beta cells, then insulin production will be very less. So this there will be the regulation of blood glucose level will be changing. So that causes type 1 diabetes. Next, type 2 diabetes. So it is often associated with this insulin resistance. So it is not going to respond to that of the insulin. So if there is cells are not responding to the insulin, then it leads to type 2 diabetes. So type 1 diabetes is due to destruction of beta cells and type 2 diabetes is due to insulin resistance. Next one is duodenal ulcer. So it is often associated with this Helicobacter pylori infection. So because of the infection of that one, we will be getting a ulcers in the duodenum. Next, gastric ulcer. It was with food intake. Okay, just now we have seen that proton pump inhibitors also. So that will be inhibiting the excess secretion of acid and thereby it protects from gastric ulcer. Right. So these are the options. So type 1, 1C. Okay. So first option is the correct answer for this one. Coming to the next question. A patient with persistent epigastric pain, okay, that improves immediately after eating, is likely suffering from. So in the first grand test 1 paper also I have discussed about this gastroesophageal reflux disorder, that is GERD disorder. Okay, if the sphincter is not closing properly, then there is a chances of reflux of the contents of the stomach into the esophagus. Okay, that leads to this gastroesophageal reflux disease or disorder. Okay, done. So what is happening here? They will be having, whenever there is a reflux of the contents back into the esophagus, they will be having pain in the abdomen and there will be a burning sensation also. So that epigastric pain which occurs immediately after eating is mainly due to this gastroesophagus reflux disorder. So option D is the correct answer for this one. Coming to the next question, peptic ulcers can be exacerbated, means it gets increased, okay, by non-steroidal anti-inflammatory drugs. Yes, reason, this is true. So when we use non-steroidal anti-inflammatory drug, there is a chances of peptic ulcer formation. So what is the reason here? These NSAIDs inhibit the production of prostaglandins, okay, which protect the stomach lining from acid production. So what these prostaglandins will do? They inhibit the acid secretion. So if the prostaglandins are inhibiting by this NSAIDs, then what happens? This excess acid production will be there in our stomach and that leads to ulcers, or it causes peptic ulcers. So both A and assertion and reason are true and this reason is the correct explanation of that assertion. So here the correct option is first one. Coming to the next question. Match the following terms related to Medical and Toilet Preparations Act 1955 with their correct description. Okay, so excise duty. So what is this excise duty? Nothing but a tax imposed on goods within our own country. So it is a tax imposed on certain goods produced or sold within a country. Okay, so that is excise duty. Next, license. So what is a license? It's an application. So it's a permission. So it is an official permission to manufacture or sell specific products. So that is license. And next one is narcotic drugs. Narcotic drugs. So these cause some mood effects, which affects the mood or behavior. Okay, so narcotic and psychotic drugs. So for that also we'll be having a Narcotic Drugs Act, that is 1967. So this a drug that affects mood or behavior regulated under Act, that is 1967 Narcotic Drugs Act. So this is option D. Next, toilet preparation. So toilet preparations, so a substance which is used to clean or groom the body. So these are the correct answers. So exercise duty B for 1, option B. So option A is the correct answer for 52nd question. Coming to the next question. A company is planning to manufacture a new line of Ayurvedic medicinal products that contain small amount of alcohol. Okay, so under the Medicinal and Toilet Preparations Act 1955, what is their first legal requirement? So they have to apply for the excise license from the state excise department. So this is a direct question. So they have to apply for the excise license from the state excise department because it contains a small amount of alcohol. So option B is the correct answer for this one. Coming to the next question. Which of the following is also called as milk of magnesia? So milk of magnesia, it is a synonym for magnesium hydroxide. It is also direct question. So in pharmaceutical inorganic chemistry, you have to go through these synonyms also. Okay, in 2018 also directly we have got 2 questions from this on this synonyms only. So make sure that you learn these synonyms. Coming to the next question. So match the following terms with the correct descriptions. Okay, so here they have given 4 options: hematuria, leukopenia, glycosuria and proteinuria. Okay, done. Hematuria, heme is nothing but it is related to blood. Urea, in urine. So blood in urine is nothing but our hematuria. And next one, leukopenia, leukocytes, it is related to white blood cells. Penia, so it is decreased white blood cells count is known as leukopenia. And next, glycosuria, glycose, that is glucose in urine. So glucose in urine is nothing but glycosuria. And next, proteinuria, so proteins in urine is known as proteinuria. So here the correct option is for 1B, so A is the correct option for this one. Okay, right. Next, coming to the next question. Match the following terms with the correct descriptions. Okay, just now we have discussed, right? Proteinuria. Let's go to next question. A patient presents with dark colored urine, okay, and lower back pain, and the urine analysis revealed the presence of RBC. So red blood cells are present in urea. So what is that one? Hematuria. What is that condition? So glycosuria means glucose in urine. Proteinuria means proteins in urine. So hematuria. So what they have found, red blood cells in urine. So the correct option is option C, hematuria. Coming to the next question. Glycosuria is the presence of glucose in blood. No, this is wrong. Because glycosuria is nothing but presence of glucose in urine, not blood. If it is present in urine, then it is said to be glycosuria. And it is often associated with diabetes. Like in diabetes patients, there we can see the glucose levels in the urine. Glucose in the urine. So the first statement is wrong. First statement is false and the second statement is true. So option D is the correct answer for this one. Coming to the next question. Match the following substances with their primary pharmacognosy uses. Okay. So beeswax, acacia, tragacanth and gelatin. This is also a direct question. So beeswax, it is used as a stiffening agent. Beeswax is used as a stiffening agent in ointments. And acacia. Acacia is generally used as an emulsifier or emulsifying agent. And tragacanth, it is having a gelling and thickening effect. It is having gelling and thickening effect. And gelatin, it is having binding effect, binding agent in capsules. Generally it is used as binding agent in capsules. So, option A is the correct answer for this one. Right, coming to the next question. Tragacanth is naturally, just now we have seen, it is naturally occurring gum obtained from dried sap of certain species of astragalus plant. Yes, that is true. It is obtained from astragalus plant and it is soluble in cold water. No, it is insoluble. So, as soon as you add this tragacanth to water, it swells. Okay, it will not dissolve. Okay. So, first statement is true and the second statement is false. Right. Coming to the next question. A pharmacist needs to prepare an ointment with a firm texture and consistency. Which substance should be recommended to achieve this property? Just now we have seen. So, beeswax is used as a thickening agent. So, here beeswax is the correct answer for this one. Coming to the next question. Match the following hormones with their primary infections. So, here they have given 4 options: progesterone, insulin, adrenaline and oxytocin. So, here progesterone. So, what is the role of progesterone? So, here generally it prepares the uterus for pregnancy. So, progesterone, estrogen hormones, they are related to female sex hormones. So, therefore, it prepares the uterus for pregnancy. And next one is insulin. So, it regulates, just now we have discussed, insulin regulates the blood sugar levels. Next, adrenaline. Adrenaline is a flight or fight hormone. Okay. So, it increases the heart rate during stress. When we are under stress or when we are under fear, it increases our heart rate. So, adrenaline. And next, oxytocin. So, oxytocin, it stimulates the uterine contractions during delivery. So, it relaxes all the muscles and prepares our body for the delivery. So, correct answer is this one, A. Coming to the next question. A patient presents with symptoms of fatigue. Here's fatigue, weight gain, okay, and next cold intolerance. So, blood tests reveal low levels of thyroxine. So, thyroxine is nothing but T4. Okay. So, generally T3 and T4 will be produced by the thyroid gland, which produces this thyroxine and T3, which are mainly responsible for normal metabolic growth of a person. So, which gland is underactive in this patient? So, nothing but our thyroid gland. Okay, thyroid gland will produce this T4 and T3 hormones. So, if there is a decrease in levels of this thyroxine, it leads to hypothyroidism. So, which causes fatigue, weight gain, goiter. Okay, right. So, coming to the next question. The reproductive system in the males includes testes, okay, and it which produces sperm and the hormone testosterone. Okay, that is correct, right? And next, testes produces testosterone hormone, while in females, ovaries will produce eggs and the hormone is progesterone. The 2 statements are correct. So, both statements are true. So, this is also a direct question. Coming to the next question. Total fertility rate refers to. So, what does it mean? Total fertility rate. So, here number of births per 1000 women? No. Number of women between 15 to 49 years. Yes. So, it gives a demographic value. See here, total fertility rate means the number of, a woman can produce, or an average number of a kids or average number of a children during her age period, fertility period, that is in between 15 to 49 years. So, the number of children produced by a woman, average number of children produced by a woman between the age of 15 to 49 years is known as total fertility rate. Okay. So, it is not approximately to completed family size. Okay, all of the above, no. This is the number of women between 15 to means which are able to give the children, give birth to a children. Next question, the natural alkaloid used in the treatment of gout is. So, this is also a direct question, that is colchicine. Colchicine is used for the treatment of gout, that is arthritis, which is due to, in the last also we have discussed about this gout, that is due to the accumulation of this uric acid in our joints. Right. So, next question, actually this is not question, just you remove this one. And next, standards for surgical dressings are included under which schedule? So, this also previously I have discussed very clearly. So, here they have given 4 options. First one is Schedule H. So, Schedule H includes all the prescription drugs. Okay, it includes all prescription drugs. So, standards and regulations for prescription drugs are included under Schedule H. And Schedule FF, already I have discussed with you. Schedule F, it consists of F1, F2, F3 and FF. Okay. So, here FF is for ophthalmic preparations. This is for ophthalmic preparations, means all the standards and regulations for ophthalmic preparations are included under Schedule FF. And Schedule F3. Schedule F3, it includes standards and regulations for umbilical tapes. Umbilical tapes, right? And next, Schedule F2 is used for surgical dressings. So, this is for surgical dressings. And Schedule F for blood bank and Schedule F1 for vaccines. Okay. So, here option D is the correct answer for this one. So, you have to learn all these schedules. These are very, very important for your exam. Next, coming to the 67th question, emergency box prepared by P&T committee. Okay, pharmaceutical and therapeutic committee contains all of the following except, okay, except ferrous sulfate. That emergency box will be containing this, all this then. Amphetamine is used for narcolepsy and phenylephrine, it is used for breathing problems, and atropine sulfate for increasing the heart rate. So, these emergency medicines are included under that emergency box except ferrous sulfate. So, coming to the next question. This acts as a shock absorber. So, both these cartilaginous joints, all these joints also have discussed in the previous class. So, synoxial joint, gliding joint, cartilaginous joint and fibrous joint. So, here cartilaginous joint, so which gives shape to our nose, ears and our larynx, etc., which covers that one. Okay. So, this acts as a cushion. This acts as a cushion, means which protects the bones from this shock, means it acts as a shock absorber and protects our bones. So, that is cartilaginous joint. Coming to the next question, triflupromazine is useful in the treatment of psychosis, is a dash derivative. Just now I have drawn this one, this is the structure of this triflupromazine. So, it is a phenothiazine structure. Okay, this is phenothiazine structure which consists of trifluo. See, 3 fluorines with propyl group and diamino group, dimethyl amino group. So, option is phenothiazine. So, you have to learn the structure also. Just combine both of medicinal chemistry and pharmacology and then you start preparing for this exam. So, coming to the next question. Match the following staining techniques with their primary uses. Okay, here they have given 4 options: gram staining, acid fast staining, endospore staining, capsule staining. And these are the different definitions of that one, primary uses of that one. So, generally there are staining techniques are used in order to identify the bacteria under microscope. Okay, so that there will be a high resolution. So, the magnification can be increased. Okay, at microscopic level also. So, there are 2 types of staining are there. So, one is simple staining and differential staining. So gram staining comes under gram staining, acid fast staining, endospore staining and capsule staining. All these types of staining comes under this differential staining. So here gram staining is mainly used for identifying gram positive and gram negative bacteria based upon the cell wall. So it is used for differentiating the bacteria based upon the cell wall composition. Yes, this is the correct option for this one. Next, acid fast staining. So generally Mycobacterium tuberculosis. So for example that one. So what it will do? It will provides, means it forms a protective waxy layer around the bacteria. So this visualizes the protective, where is that waxy layer? Alright. So acid fast staining identifies the bacteria with a waxy cell wall. Okay. Next, endospore staining. So some bacteria they will be having endospores, okay, that are in dormant stage and they will be very strong and it prevents easy killing of that one. Okay. So this endospore staining, it detects the presence of spores in bacterial cells. And capsule staining. Capsule staining is a technique which stains the this capsule. So what is this capsule? So this bacteria, they form a outer protective layer called glycocalyx. Okay, that can be as a thin form or as a thick form. So thick form is known as capsule. So this visualizes the protective layer around some bacteria. So 1A, 2B. So this is the correct option for this one. Coming to the next question. A microbiologist observes pink colored bacteria under the microscope after performing a gram stain. So what does it give? Infers. Okay, right. So here just now I told there will be, means gram staining is of two types. Okay, so gram staining is of two types. Means generally bacteria will be two types, positive bacteria, gram positive bacteria and gram negative bacteria. Gram positive and gram negative bacteria. So generally this gram positive bacteria will be having a thick layers of peptidoglycans. It consists of thick layers of peptidoglycan. Whereas gram negative bacteria consists of a thin layer of peptidoglycan. A thin layer of peptidoglycans. Okay, done. So when you are staining this bacteria, you have added this gram stain to this one. So in this you will be using two stains, primary stain as well as the counter stain. So primary stain will be used, so crystal violet is used as a primary stain and a counter stain will be like saffronin or iodine is used as a counter stain. So here what they will do, first we will be adding the crystal violet to the bacteria. For example, you want to determine whether positive or negative bacteria. So if you add crystal violet, this is the primary stain, then what happens? This means if it is a gram positive bacteria, it will retain the violet color over that one, so that we can observe the bacteria directly under microscope which are in blue in color, okay, violet color. Done. So for example, if it is a gram negative bacteria, so in the next step what you will do, you will wash this with either alcohol or acetone. Alcohol or acetone. So what happens when you wash it with this alcohol? If it is a gram positive bacteria, even if you are washing also, it will retain this crystal violet color. So it won't have any issue. Whereas gram negative bacteria, so for this if you add a crystal violet, okay, then if you add alcohol, then immediately alcohol will dissolve this peptidoglycan layer. Okay, so next step what you will be adding? In the next step, when you add this saffronin as a second or counter stain, then at that time this bacteria will hold this saffronin and it will give pink color to the solution. Okay, so if it is a gram positive bacteria, then it will retain the crystal violet color, means violet color, and it will not give any further stain. But if it is a gram negative bacteria, so first when we are adding crystal violet, it will not get any stain, and later on when you are adding this saffron into that one, it will impart pink color to the bacteria. Okay, so they are gram positive. So here they have given options. The first option is they are gram positive and have a thick peptidoglycan layer. Okay, they are gram negative and have thin peptidoglycan layer. So this is the one. Next, they are gram positive and lack a cell wall. What they have given option? A microbiologist observes pink color. So here gram negative bacteria will produce pink color. Okay, so therefore the correct option is this one. They are gram negative and have thin peptidoglycan layer. So option C is the correct answer. So this gram staining is also very important. Right, acid fast staining and everything you have to learn and learn those dyes also, stainings, what crystal violet, saffronin. So all those things you have to learn. Next, coming to the 72 question, they have given assertion, isolation of pure cultures from mixed microbial population is essential for accurate identification and study of microorganisms. Anyway, if you are in combination, if you separate, then it will be very easy for us to study. So assertion is correct. Reason, mixed cultures can lead to contaminations. Yeah, if they are in mixed, then it leads to contamination and misidentification may be chances. So here both assertion and reason are correct, and reason is the correct explanation for this assertion. So this is the correct answer. Both assertion and reason are true, and reason is the correct explanation for assertion. Coming to the next question, match the following poisoning symptoms with the correct toxic agent. So here they have given poisoning symptoms and poisons, various poisoning. So here first one is paracetamol poisoning, atropine poisoning, organophosphonate poisoning and serotonin syndrome. Right. So paracetamol poisoning. So dry mouth, dilated pupils and rapid heart rate. So just now I have discussed with you atropine. So atropine is used to increase the heart rate. Generally atropine is used to increase the heart rate, and this atropine is used for treating the organophosphate poisoning also. But in case if atropine is overdosed in a person's body, then it leads to atropine poisoning. So at that time what happens? If atropine is more, it leads to rapid heart rate. Okay, so dry mouth, dilated pupils and rapid heart. It is due to overdose of this atropine. And second one, nausea, vomiting, abdominal pain and jaundice. So that will be due to this paracetamol poisoning. See, if the overdose of the paracetamol also leads to abdominal pain. Next, sweating, salivation, muscle twitching. Okay, this is due to organophosphate poisoning. Sweating, salivation. See, generally what will atropine do? Atropine will decrease the secretions. This atropine, they will reduce the saliva, at the same time bronchial secretion. So that's why we will use atropine as a antidote for this organophosphate poisoning. So in case of organophosphate poisoning, there will be lot of sweating, salivation and muscle twitching. So next one is hyperthermia, confusion and agitation. So that is due to serotonin syndrome. So what is the correct option here? So option A is the correct answer for this one. Coming to the next question, a patient presents with dry mouth, okay, next flushed skin, dilated pupils and rapid heart rate. Just now we have discussed. So after ingesting an unknown substance, so which is the following is the most likely cause of these symptoms? So it is due to atropine overdose. So due to atropine overdose, the person will be having these symptoms, because it is a generally it will increase the it is mainly used for curing this bradycardia, that is slow heart rate. So if there is overdose, then what happens? It will increase the rapid heart rate. So next question, N-acetylcysteine. Okay, it is effective in treating paracetamol poisoning if administered within 10 to hour. 8 to 10 hours of ingestion. Yes, that's true. So, generally N-acetylcysteine is used as an antidote for this paracetamol poisoning. So, what is the reason? So, this N-acetylcysteine replenishes glutathione levels. Yes, that is also true. In the liver, preventing hepatotoxicity caused by the toxic metabolite of paracetamol. Yes. So, here what happens if a person is having paracetamol overdosage? So, generally if we take the paracetamol, that will be eliminated out of the body by two major metabolic pathway is there and minor metabolic pathway is there. So, in major metabolic pathway, this paracetamol will be eliminated by glucuronidation and sulfate pathway. Okay. So, generally about 50 to 70% of paracetamol will be eliminated by this major pathway, but 5 to 15% of this paracetamol will be eliminated by this P450 enzyme, by oxidation by the P450 enzyme. See what happens, this P450 enzyme, it causes oxidation of that paracetamol and then what it will do, it will convert that into a toxic metabolite, that is N-acetylcysteine, this benzoquinone imine. So, this is the toxic metabolite which is formed in our body. Then what happens? Immediately glutathione. Okay. So, this glutathione, it will bind to this one, conjugate, and finally that gets into separate, that will be gets metabolized into cysteine and finally it will be eliminated out of the body. Okay, done. But what is happening here, if the glutathione is very less, means in normal condition, if you are taking normally, like whatever the dose that recommended by the doctor, we won't have any problem. If there is overdose, then what happens, this N-acetyl benzoquinone imine toxic will be more, means that metabolite, toxic metabolite will be more and glutathione will be very less. So, in that condition we will be having the toxicity of this one. Okay. So, what we have to do? So, we have to use the N-acetylcysteine. So, this has the capability to replenish this glutathione. So, it increases this glutathione availability, so that whatever this toxic metabolite is formed, that will be eliminated out of the body by using this glutathione. So, both are true. Assertion is true and this explanation is also true. So, the N-acetylcysteine, it replenishes glutathione levels in the liver, preventing hepatotoxicity. So, the correct option is both assertion and reason are true, and reason is the correct explanation for assertion. Right. Coming to the next question. Progestin only pills are a type of pills, nothing but they are called mini pills. They are a type of oral contraceptives used by women who cannot take estrogen. Reason, progestin only pills are less effective than combination pills in preventing ovulation. See here, what they have given assertion, progestin only pills are a type of oral contraceptives used by women who cannot take estrogen. Yes, that's true. See, progestin means their mini pills are most commonly used by women who cannot take this estrogens. That's true. But what is the reason here? Progestin only pills are less effective than combination pills in preventing ovulation. So, this is also correct. Reason means this statement is also correct. So, in means comparison with that of only progestin pills, means with mini pills with that of the combined pills. If you take combined pills, these combined pills consists of estrogen and progesterone. Okay, it will be having estrogen and progesterone. So, what this will do? Progesterone will prevent the ovulation, whereas estrogen, it maintains the menstrual bleeding, means after menstruation it regulates the menstrual flow, menstrual bleeding. So, if you take the combination, then we will be having we won't have any side effects in future. But those patients who are not able to take the estrogens, they will be taking only on mini pills. So, both the statements are correct, but this is not the exact reason for that assertion. So, here both assertion and reasons are true, but the reason is not the correct explanation for assertion. This is the correct answer. Coming to the next question. Which hormone is primarily responsible for thickening of the uterine lining during the menstrual cycle? So, progesterone is the main one which helps in helps for thickening of the uterine lining during the menstrual cycle. Okay. So, estrogen generally it helps in developing the secondary sexual characters. Okay. Right. Coming to the next question. Melanin is derived from which of the following amino acids? So, tyrosine. It is a direct question. From tyrosine, the melanin pigment will be derived, and this is responsible for our color of hair, eyeball, okay, and skin also. Coming to the next question. Phylloquinone is another name for. So, it is also a direct question, that is vitamin K is known as other name for vitamin K is phylloquinone, and what vitamin E is, it is a tocopherol, it is an anti-sterility hormone, and next vitamin D calciferol, and vitamin A is retinol. Coming to the last question. Right, which of the following is not a common emulsifying agent? So, already we have discussed the starting questions. So, emulsions are stabilized by using emulsifier. So, here they have given different emulsifier, that is lecithin, gum arabica, sodium chloride and egg yolk. Okay. So, lecithin is it acts as a emulsifying agent. Okay, it acts as a emulsifying agent. So, here what is the question? Which is not a emulsifying agent? So, here egg yolk generally consists of this lecithin. Egg yolk will be having this lecithin, and which acts as a emulsifying agent. Okay. So, gum arabica is also used as a emulsifying agent, and egg yolk also contains this one. So, these three will be acting as a emulsifying agent, whereas sodium chloride, this will not act as a emulsifier. Right. So, these are the assertions for answers for all these questions, and if you have any doubts also, you can post your questions, so that I will be answering that each and everything. Right. Thank you.